If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. Our guest today is Kavitha Gnanasambandan, co-founder and chief commercial officer of Blooming Health. Blooming Health is powering healthy aging in place by creating the leading remote engagement solution for senior care providers to proactively engage older adults with holistic aging in place services and build trust. In this episode, we discuss patient centricity in age tech and how it can empower our elders to age on their own terms. Let's get started. Hi, thanks so much for connecting today.
Thank you so much for having me. We are very grateful to have this opportunity.
Excellent. So let's start from the beginning. How did Blooming Health get started? Tell us about the journey.
Yeah, definitely. So to tell the journey of Blooming Health, I definitely need to start with the story of the three co-founders. So my name is Kavitha Gnanasambandan. I'm one of the three co-founders of Blooming Health. And we have two other co-founders, Nima Ruhi, he's the co-founder and CEO, and Naman Gupta, who's the co-founder and chief product officer. So the three of us really have very complementary backgrounds across healthcare, data science, product management, and business execution. But what really brought us together is our passion for healthcare and solving problems in healthcare and having an impact. And all three of us are also first generation immigrants who came to this country for our education and built our careers here over the last 10 to 20 years. I think one of the key aspects that you should know about each of us is, for example, in my case, I have a passion for healthcare because I went from biomedical cancer research into healthcare and got to see firsthand the problems in our system, especially around the lack of patient centricity. This was a key driver for me all along in how I can be part of solutions that are more patient focused and emphasizes the outcomes less than the incentives and the financial aspects of healthcare delivery per se. So one of the things, again, my co-founders also care about is for Naman, for example, he has 15 plus years of experience in digital transformation and product development, but he consciously made a decision to move into healthcare because of the dissatisfaction he had with the healthcare delivery system. And Nima has background in AI, data science, and had a really thriving career in corporate as well. But he decided to, again, think about more healthcare reasons because he was a caregiver for his in-laws and others, family members who had various healthcare issues. And so he also wanted to create an impact with his skills in this space. And for me personally, it was the loss of my grandmother. She was very close to me, and I lost her around 2015. And in being in touch with her via phone from here, I could sense the loneliness as she felt during the last few years of her life, even though she was surrounded by family members, as she lost some of the loved ones, as she felt more depressed for certain reasons over the end of her life. I could really sense that there's an opportunity here to really make aging more positive and better for everyone. So all of us had these personal reasons why we were interested in this space. And around 2019, I was actually volunteering with the Department of Aging in New York City and got to witness firsthand how community organizations were playing a critical role in addressing social needs of older adults. This was a new exposure for me for a person who's been in healthcare all along. I never thought about how 80% of our health outcomes are actually driven by non-medical events and services that occur outside the hospital walls. So this was an opportunity for me to learn about the amazing work that community organizations do and how they do it with a trusted relationship with older adults. So this was an observation I had. And then around the same time, I met Nima and Naman in Brooklyn during a hackathon, actually, where we were all there as industry experts. And on the side, we were all having conversations about the different things we were interested in. And that's how the three of us collided together and started working on this in 2019. And I shared my observations from working with community organizations, and all three of us agreed that aging is a key problem that we wanted to solve for, because we've all seen how aging used to happen in our own countries. And in the US, around 27% of the older adults are aging alone in their own homes. So there is an increasing need to support the growing aging population, while there is not enough supply or caregiving services that are or care providers to support the increasing need of aging support for these populations. So that's how we got started on the journey. Let me pause here and see if you have any follow-up questions.
I love that story. I love that your team has, one, an extensive history and experience in healthcare to begin with. And I love how the connecting factor also is that you guys all have personal stories related to family members that are elderly or are elders of this world. I too am in the process of speaking with my grandmother. My Momo is what we call grandmothers. I'm originally from Louisiana, and she is aging alone in her home by herself. And it's a very tough thing to see and to witness. It's a very tough thing being out of state to try and find support for them.
Yeah.
And I think one thing that you said that really hits home is that a large percentage of the care is non-medical. It has to do with loneliness. It has to do with other human-to-human interactions that are really critical at this time in life. And there aren't enough solutions that cater to that. And looking at the age tech, elder tech, senior tech, however it's sort of being described today, market, it is around $2.7 trillion in market size is what some estimates have out there.
Yeah.
And there are a lot of companies trying to address several components of aging and aging well. And one thing that's happening is that the market is becoming extremely fractured because of this. I think these solutions obviously need to run their course, and the right solutions will come from it. But the thing that I'm curious about is, what do you believe to be fundamentally true about aging well? How will someone age well?
Yeah, no, that's a very good question. And the definition of aging well is definitely going to look different for each of us, right? And it has been changing over time. So to level set the playing field here, what we need to recognize is that traditionally, how we've been thinking about aging is we all have a phase when we are growing up. We go to school, we learn, we then have a career, we are working, and then we retire. And all of this happens on average in a span of 60 to 70 years, right? And this was even lower during the times of our parents. But today we are living in a span of life where the average lifespan for somebody is increasing. We are living longer, and it looks at least like 80 to 90 years on average that somebody is going to live. And we've seen this vary across the countries in the world. But on average, let's say, assume we're all going to live for 80 or 90 years on average. And some people may live even up to 100 or 110. So given that context, how you think about aging needs to change. And so it's not just about, okay, I'm going to retire and I'm going to live on my own, but also it's in general, how are you going to adapt to the changing life circumstances? One thing that is going to be common is the functional capacity of our body decreases as we age. That is a fact. But how we track that aging trajectory, there are different phases as you age that you need to think about. The relative proportion of the time that you are staying independent physically, mentally, socially is one aspect of it. And so that is then defined by where you age and how you age, right? You want to age in your own homes and communities. That's 90% or more of folks that prefer to do it that way, because they want to be surrounded by people that they love, people that they're familiar with, especially as they age and they become less independent. And then there is also this component of how you age. As I said, you want to maintain your independence to some extent and your dignity, even if your physical capacity goes down. So they are looking to plan, how can I maintain my lifestyle even if my physical capacity goes down? So that's where some of the adaptations around aging in place comes into play. And how you change the way you live in terms of your home modifications or having additional supportive services, especially if you're living alone or living with your spouse mainly. You may need more support with your day-to-day social needs, like food, like housing, like transportation, and also with delivery of medications or going to the hospital. There's so many of these day-to-day needs that we usually take for granted that becomes important to consider as we age. And then the third aspect is definitely social connectedness. How do you stay connected and maintain that social health as you lose some of your loved ones or you lose some of the connections that you are used to, and keep renewing them with intergenerational connections or other means with people around you. And then the last aspect I would say is meaning and purpose. So in different stages of our life, again, we have various things that drive us. And so you want to continue to maintain that key driver or a purpose that is helping you get up from the bed every day and move around your life. So maintaining all these aspects that helps you live a holistic life is how I would define aging well, and in a way that's not like we need to reframe how we think about aging overall.
I think the reframing is definitely necessary, especially because we are living longer.
Yeah.
Because we are more technologically advanced, because also we are a little bit more dispersed than we have been in the past. And so those safety nets of multi-generations living near or by are also a big gap and play a huge part of the caregiving gap that's happening in the elder community. I love that as you described what it meant to age well, you did present a very holistic view of what that looks like. And one of the things that I think digital health can do better at is looking holistically at their patient population when they're creating tools for them.
Yeah.
And I think tying closely together the social determinants of health is probably the easiest and most direct way to do that, as well as it will allow for companies to build for the most common and lowest denominator of patients that are going to need the help the most. And so where do you, or what does Blooming Health see social determinants of health coming into play in what you're building and the patient population that you're serving?
Exactly. I totally agree with what you were saying about the role of technology in enabling social determinants of health. So at Blooming Health, the way we are looking at this is in two angles. One is using technology to streamline the delivery of social services for older adults and improving the efficiency there and making it more scalable, in fact. So one of the things that's true about social services and how it's done today is it's being delivered in a very culturally sensitive manner and in a way that enables the delivery people, like the service folks, to build trust with older adults. So that is a key learning for healthcare in terms of how can we learn from social services and use those principles. So we've tried to incorporate those principles in Blooming Health's technology, and we help connect social service providers and any kind of aging service providers to better engage older adults in a way that's, again, personalized and in a way that builds trust. So that is one aspect, is to use technology to streamline service delivery and improve efficiencies. And I'm going to get more in detail of the technology shortly. And the second aspect is around data. So one of the things in healthcare is, as I mentioned, 80% of our health outcomes are derived from non-medical aspects of our lifestyle and services that are delivered outside the hospital walls. Yet, the data capture we have in our system is very underrepresented when it comes to social determinants of health. And we're not accurately capturing somebody's race, ethnicity, age, and also, we're not capturing their social health risk factors in terms of their food insecurity or transportation. So we want to address both of these aspects via Blooming Health, using data to better capture these underlying gaps and disparities, and enabling better care for everybody and enabling better health and social equity. And then the second aspect is using technology to streamline service delivery, again, in a way that builds trust. Because traditionally, the use of technology has been more institution-centric and not patient-centric. So the way we use Blooming Health, and specifically to answer your question around social determinants of health, we started by working with community organizations that address the social needs of older adults, because we recognized, as I mentioned, these institutions are delivering really valuable social services for older adults, yet they're not very scalable, and they don't have a lot of digital technologies that can help them to automate some of the mundane tasks and focus more on the human component of the service itself. So Blooming Health's remote engagement platform enables the service providers, aging service providers, to reach older adults and engage them with your services in an inclusive way. So we have a centralized communication platform through which the service providers can send communications to older adults, and via text, phone calls, or emails, and in multiple languages. So you can meet them where they are. And then number two, you can understand the needs that they have on a day-to-day basis. So you can check in on them to first understand how they're doing, and also to understand if they have any needs around food. Do they need any meals, housing, and transportation? How are they doing on all of these aspects on an ongoing basis? And so we can bring to surface the people who are most at risk and those who need these services at this point in time, and then help the service providers to focus on those people so they can better align their resource capacity with those in need at that time. And the second aspect is social connection. They can also use our platform to inform people about the resources and also events that are happening in their community around, in terms of, say, anything from arts and music to health and wellness, exercise programs, and also to inform them about public benefits like food insecurity and food stamp programs, tax benefits programs that they can take advantage of, and help them enroll in those services.
Excellent, excellent. I love hearing all of the ways in which you're tackling this problem. There's a lot of contention about age tech when it comes to technology that is patient-centric. There are some in a camp that believe that it should be institutional focus because this population is not going to be technologically capable or able to navigate the variety of tools that are being currently built in the digital health space. And then there's a camp that believes that actually this population has shown a propensity and interest in using technology. There's several data and analysis and publications around the increased use of technology in the elder population. And when I think about the current elder population, as well as those that are coming behind them, I'm inclined to believe that the patient centricity of it is actually not an issue, because they're interacting with their children who are using phones and tablets and other apps, because their children who are going to be soon to be elders are going to be used to using those things. And so I'm curious, what is your take on the interest or the ability for seniors to use tech for their care?
Yeah, no, that's a really important question and an interesting one that we've thought about. So, as you know, my co-founders, they all have backgrounds in technology, and I was in a digital health company as well. So, in general, we believe in the power of technology for older adults to better connect with a society. So, at a high level, at the market trend level, I agree with you. There is increase in adoption and interest from older adults to use technology, and COVID-19 has accelerated this interest and adoption. But what we need to recognize is there are still pockets of older adult populations that are not connected to the mainstream society because of the digital divide or the technology divide issue. And in terms of the technology divide and the barriers related to it, it comes from three levels or three factors, if you will. Number one, access to technology. At least 20% or so of older adults in New York, for example, don't have access to broadband or Wi-Fi, which is an interesting fact to many because we all take Wi-Fi for granted and we are using it for various reasons. So,
Yes,
so access to technology is number one. And number two is comfort with technology and technology literacy. And this relates to some extent with generational difference. I wouldn't attribute it mainly to age because, as you can imagine, we all grew up with computers and we used it for learning, we used it for our work. But there is a generation that did not grow up with computers and they are not as used to learning different levels of technology that we have been adapted to. We went from using floppy disks to currently to using cloud-based storage service, at least during my career. So I'm able to see how things change and I'm able to adapt to it. But even for me, I can imagine in the next 20 to 30 years, technology is going to change from laptop based to probably more VR, AR, and many things that we don't know yet. So there's always this generational lag, if you will, in adopting technologies. And therefore, we need to be mindful of how we develop technologies in a way that is considerate of the different user personas. So even among older adults, there's a spectrum in terms of interest and adapting to technologies. Some people are very comfortable in learning new smartphones and apps and are using it on a day-to-day basis. And on the other end, there is a population that's not as interested. So even if you address the access issue and give them a tablet and give them Wi-Fi, there's still a level of mistrust or lower trust in technology. So there's a lot of design that needs to be incorporated in how we develop technologies and also enable training and learning to new technologies for older adults. And so these elements are really critical to understand when we think about older adults. And we also need to remove this ageist mindset when we think about older adults, because we often think that the older adult persona is being not considered because they think about older adults as somebody who's frail and is sitting at home and is not as interested in being connected or in a fun way with the society. So that kind of mindset needs to go down for us to then develop more inclusive technologies that are inclusive of all different kinds of personas and including people in terms of their comfort and access to technology.
Ageist is exactly the right word that should be used here. There are preconceived notions about who this patient population is and what they look like and what their capabilities are. And in building, we need to test those assumptions. And I think in testing them, we'll find that what was previously imagined may not be the case. And that instead of trying to build for our image of what the current population is, we have to build for the continuum of technology development. Because I too came from the era of floppy disks and printer paper that you had to pull the sides off of, the early ages of the technology revolution to now.
Yeah.
VR, AR. And it's changed quite a bit, and we've adapted. And I think that is probably the better approach of building technology that is going to be adaptable to the changes that are coming, rather than trying to build it for a persona of a patient population that, as we all know, people do change. And so that's a beautiful way of saying it, and that's a beautiful way of thinking of it. And I hope that others take that perspective as well. And so I want to talk about some of the work that Blooming Health has recently been doing. I want to talk about your recent partnership with the city of Yonkers. Tell us a little bit more about it and how it came about and the exciting work to be expected from it.
Yeah, thank you so much for asking. So at Blooming Health, we are continuously expanding our network of partnerships with community organizations, and we also work with cities and municipalities with a focus on aging population. So this partnership with the city of Yonkers, we are very grateful for that. It happened in 2021. We started with a 3-month pilot where we wanted to help the city of Yonkers, naturally occurring retirement community, as they call it, NNORC, to help use Blooming Health platform to communicate with their older adults and inform them about the programs that are happening in their community regarding, again, exercise programming, arts programming, and wellness programming. And this was, again, during the pandemic when it was still all virtual. So they needed to inform the older adults about the programs on a day-to-day basis, along with delivering the relevant information about where it's happening and the links, etc. So we were able to do this pilot with them, and we had very defined success metrics that we were tracking. One of them was around how are we improving the engagement of older adults with the programming that is being offered by the Yonkers and NORC. And this we saw over the period of the 3 months, we were able to increase it by 2x relative to what it was before. And also this was increased by 2x relative to the population that was not on Blooming Health or not receiving the communications via Blooming Health. So this helped demonstrate that we were driving this increased engagement for older adults to receive and engage with the services that were being provided by the Yonkers and NORC. And we were also saving time for the staff, because the staff could now focus more on actually designing the programs and delivering them in a way that's satisfactory to older adults versus having to send out communications which can be easily automated. And we were also able to send these communications, as I said, via text, phone call, or email based on the preferred communication channel for older adults and in their preferred language. So this made it relatively easier for the staff to focus on their mission critical tasks, which is in enabling aging in place for older adults. And then the third aspect was the older adults themselves were highly satisfied with the services we delivered and really wanted to continue receiving the communications. They felt they were more informed and connected to their community because they were receiving these communications in a consistent and timely manner. So based on these results, the city of Yonkers were really happy about the impact of our services for their community. And so they wanted to, again, expand using our services across the city of Yonkers for all their older adults and across their different programming, starting from home delivered meals program, housing, and they also want to use this to check in on their older adults' health conditions and deliver them with and support them with the necessary services that they need for aging in place and living well in the city of Yonkers in Westchester County. So we were really happy that it was a more outcomes and data-driven project that led to satisfaction for everybody involved, and are very happy about the partnership with the city of Yonkers and our partners there.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.